I'm Dr. Matt Deppe. I'm a general surgeon with Mayo Clinic Health System. And one of the areas that I have particular interest and passion is in colorectal cancer prevention. I think there are a few things that patients don't know about colonoscopy and about colon cancer screening that might alleviate a bit of concern or help them make better decisions about choosing to do a colonoscopy or choosing the screening technique that's right for them. I think one of the things patients don't realize is how far the equipment has come technologically. In our system, we use the 190 series Olympus equipment, which is the newest on the market and has a lot of features that help us keep patients more comfortable as we do the examination. Our typical patient who should be screened for colon cancer is any patient over age 50. There are patients, however, who have a family history of colon cancer in which, depending upon when their relative had colon cancer, will recommend it at an earlier age. But, of course, any patient who has symptoms, blood within their stool as an example, are patients who we more urgently push to consider colonoscopy for safety reasons. Colonoscopy begins with a patient taking a preparation, which is medication that's taken by mouth to clear out the colon. Clearly the least pleasant portion of the procedure. Most patients come in and they think that there's more discomfort ahead, and certainly sometimes exams can be more difficult than we anticipate, but usually they're not. And usually patients are surprised to find they have no discomfort, and my favorite phrase, "You're done already?" which I really enjoy, and I think all of our endoscopists do. So we have several options for anesthesia. Our most common choice is what's called conscious sedation. That involves, for most practitioners, a medication called Versed and also a pain medication called fentanyl. And they're both designed to be effective very quickly and very reliably effective and very short duration, in that they wear off very quickly and we can predict how long they'll be within a patient's system. That being said, about 10% of our patients will choose to have no medication for their colonoscopy. And of course, if we think that that's not a great idea, we'll advise them otherwise. But for most patients who choose that, they have a pleasant experience and are comfortable throughout the examination and are able to essentially leave immediately after the examination is finished. We also have a third option, which is anesthesia provided by our anesthesia practitioners. And that means a deeper form of anesthesia. There are some benefits to it and some negatives to it as well. And some patients will choose that option because of previous experience with colonoscopy or other anesthetic experiences. I think another thing patients don't realize is that recovery is very quick. Perhaps years ago it was several hours of trying to pass gas, trying to feel less bloated, waiting for medication to wear off. Now we use carbon dioxide in order to see within the colon. What that means is that it absorbs in just a matter of minutes. So patients, even a half hour after the examination, no longer feel bloated and feel normal. So our patients are staying much less, for a much shorter duration in our recovery area after the procedure and are able to go home feeling normal. The common concerns that we have from patients are, will I have more discomfort than I anticipate? Will it be difficult for me to get through the examination? Will I be bloated for hours after the examination, as an example? And I think the thing that patients find most comforting is not only experience of their friends and family who undergo the examination now, contemporarily, but as we start the examination, some patients may choose to be awake to see what it feels like to start with. And often those are the patients who are flabbergasted when we've completed the examination. And the first thing they do is tell their friends. I think the important thing when it comes to colorectal cancer prevention is do something. Colonoscopy is for many people the best test and the best option, and is the end evaluation, the end tool that we have to evaluate the positive results from some of our other screening examinations. But the key is do something. This is a condition that in many cases is preventable. Why not?